Okay, so Frederick John Brown has suffered a seizure, and we're going to administer Midazolam, but before we do that, we're going to check on a few things. We're going to check for the ampule of Midazolam, which we have here. We've got the syringe, which we have here, which I've already taken out. We've got the hand sanitizer or water, so I can wash my hands or clean my hands. We've got gloves, which is here, and the emergency medication order, and the tissues for cleaning up afterwards. So we've washed our hands or applied sanitizer, and then putting on, assuming we've got two gloves, put on the gloves. And check the written instructions on the emergency medication order, including the identity of the person. So it's for Frederick John Brown, which we have identified, we know him, and his birth date's 1st of April 1992. The order says to read the doctor's instruction, check the person's identity, which we have, it's Frederick John Brown, and the packaging for medication name, expiry date, dose, and volume to be given. So we've checked that. It is Midazolam. It is for Frederick John Brown, either to be given buccally or intranasally, and the dose and volume 5, to be given at 5 minutes or after, and administer the 5 milligrams per 1 mil. So it is the 1 mil of the medicine, and we're checking that the medication is in date, so it is, it hasn't expired. We've twisted the top off the medication ampule, so that was already twisted off. I've taken that off. I'm going to draw out the 1 milliliter of the medication, which is so. And I've got a buddy with me, so I'll get them to check it is 1 mil as well. Right. We're checking that Frederick John Brown is still in his seizure, and if he is still seizuring, I'm going to call him by his name. Frederick, I'm about to give you the medicine that's going to help stop the seizure for you. We're going to position on his side in the recovery position, and then we're going to insert the ampule into his mouth between the lower cheek and teeth, and then we're going to slowly squeeze the syringe to give the medication. So we've done that. Now we're going to wipe away any excess fluid from the medicine. I'm going to keep Frederick John Brown on his side in the recovery position. I'm going to keep monitoring him, checking his breathing, noting his skin colour, and staying with him until he has recovered or until the ambulance has arrived. And we did call the ambulance earlier per the administration order, because it says to call an ambulance as soon as the seizure starts. Alright, so in the meantime we can document what happened when he started seizuring, the signs of the seizure, when the time of administration of the Midazolam, the quantity, and so on, and any observations that we've noted about his appearance. And then we're going to tidy up and discard any of the used medication. Right? Of course, we're prepared to commence resuscitation if needed while we're observing him after giving the Midazolam. Thank you.